What do you think about all the self-diagnosing that's going on these days?
Yeah, there's a lot of self-diagnosing, and I get it. I think right now in general, the anxiety level just culturally has increased, and that makes people even more want to know what's wrong with me, and how do I fix it. And there's so much more information out there, and AI can diagnose you. But I think a big thing there is why. What does a diagnosis mean to you? What does it do for you? How is that something that is a tool that's going to serve you? If you want to know what's wrong with me, I would, as a therapist, I think going to a professional who is trained in diagnosis, in assessment, is the place to start. But even with that, the therapist asking that question. So, for example, someone really believes that, okay, I have ADHD, it's so important to parse out the roots of that, because what looks like ADHD neurologically a lot of times can be trauma related. So that's really important to know. So if I say, okay, I have ADHD because I can't seem to finish anything, I can't focus on anything, I'm really, really sensitive to rejection, which is often a part of ADHD. And so I look online and check off. Okay, I have ADHD. And then let's say I find a provider who will prescribe, Ritalin or whatever. What about the trauma? That's still not being addressed. That's not being healed. If what you want is to feel better, to understand yourself better and to feel better being alive, in this body, in this life, then it's important to understand where that's coming from so that you can go to the root of it. There are a lot of adult diagnoses of ADHD. And I think in a lot of cases, mostly females are realizing a little later in life, oh, that wasn't because I was stupid or inadequate. That I have this neurological condition in which a particular part of my brain is not functioning at the level that it should to filter out all stimuli, right? I need something to help address the function of that part of the brain so that I can filter out stimuli and focus on the most important stimulus.
When you're diagnosing someone or when someone is self-diagnosing, how do you think about the difference between the traits that we all have? We all have certain moments of feeling depressed or anxious or trouble focusing or being self-absorbed. When does that self-absorption become narcissism? When does feeling depressed become depression?
Right.
How do you think about where that line between being a normal human with normal struggles versus having a diagnosed pathology?
Wow, that's huge, because I think that the DSM, no, the Diagnostic Manual diagnosis is incredibly important for some people in order for those people to get appropriate care. And I also think that for people, for example, with complex trauma, a diagnosis is not always as helpful. So pathologizing is not always really contributing to healing. So I just wanted to say that. And to answer your question about that line, between, okay, I'm having, there are periods of time when I can't focus. There are periods of time when things feel dark, when I feel like I'm, down in a hole. where's that line between that and a straight up diagnosis? Technically, the line is, to what degree does it impair your function? I mean, that's the language. So from my perspective, though, honestly, yes, I diagnose. That is incredibly important, especially, because I take insurance. However, in the relationship between a client of mine and me, it's a healing relationship. I'm honored to be there. I'm not the one doing the healing. And diagnosis often does not lead the relationship. It really doesn't.
What does?
The person's awareness of where their wounds are, what's causing the disturbance, what's causing the distress. Let's go there.